Welcome, everybody, to a Friday edition of the Clinical Consultation Network. We had so much fun on Tuesday, we decided we had to do it all over again on Friday. And so we have with us again today Aaron Todd and Rachel Shane, two great folks who talked. Let's see, the person that we were talking about on Tuesday's name is Cindy. Is that correct?
Yes.
Thought I remembered it correctly. That's a pseudonym for everybody out there because we don't reveal people's identities on this network. So appreciate you guys coming back in to talk to us a little bit more about this today, because we didn't really get into the brainstorming phase, and this actually is the phase that I hope that our listeners will, or our watchers, whatever, will join in and ask questions also, or provide suggestions or thoughts that they might have. I was qualifying just prior to coming on here that whenever we talk about these cases, any observations I might make are taken with a grain of salt, because you guys are much closer to the situation. You've been working with this person, you know her best. So you kind of just take these with a grain of salt and kind of think about how it might affect anything that you're doing. And some of the things that we'll talk about today will just be questions, maybe questions to think about, questions to ask yourself as you go forward and try to help her. So before we get into all that, maybe I could start with you guys just giving us a little bit of a thumbnail recap of what we discussed the other day, so it kind of jogs everybody's memory about what we were talking about. So if you guys could start with that, then we'll launch into some thoughts and questions.
While Michelle's putting that on screen, Cindy, just very briefly, she's a 22-year-old female, got several diagnoses, including schizoaffective disorder, bipolar type, and mild intellectual disability. On several different medications, she does frequently refuse her Invega Sustaina injections, and refuses other medications as well, and that's actually been increasing since her boyfriend moved back in with her. And that's kind of the main point of contention with the COS, is that her boyfriend was arrested in November for domestic violence, and I believe some probation issues or violation issues, and he recently was released in April and has since come back into her life. She pretty much just lets him come and go from her place as he pleases. COS has a lot of concerns around this, obviously, emotional, and there's been, he is going out a lot, he's refusing to wear a mask, he comes back in, so he's not following proper procedures as far as, COVID goes. He's also very obsessed with becoming pregnant and wants to get her implant taken out, and has been having trouble finding a doctor willing to do this. So this has also been a big source of frustration for her. Erin, can you think of anything else that I'm leaving off and kind of like a brief recap?
No, I think that's great. She's become physically aggressive towards her staff members. She stays at home a lot. She previously enjoyed going out, staying busy, and she self-reported that she does very well if she's able to stay busy. But now she stays at home, pretty much waiting for her boyfriend to return at some point during the day or the evening. He's very manipulative. Like we said, he was arrested on domestic violence when they both got into a physical altercation. So the circle really is open to ideas on how best to support her. In addition to the increasing ideations of pregnancy and a desire to become pregnant, especially because her boyfriend, Cindy's boyfriend, does not want to have a child, and so that sometimes can even trigger arguments between the two of them.
Yeah, and one of the things that we talked about on Wednesday was the behavior contract that Erin had come up with the COS and with Cindy's input. And so we really just kind of wanted to see what other questions and comments and recommendations other people might have.
Yeah, and the contract, how has the contract worked so far?
I haven't gotten any calls, so that usually means that's good.
Oh, okay. Yeah, that can be a dangerous thought sometimes I've found.
Not Collier.
Of course, I will tell you, I had Trey check back on somebody else that you guys probably know, who we've talked about on CCM before. And I think probably he inquired of you, Rachel, about that person. And I was actually pleasantly surprised at the report on that person, even though I hadn't heard anything about her in a couple of months. But usually, if I haven't heard anything, I'm thinking, oh my gosh, I don't want to check because I'm sure I'm going to find out that there's been some stuff going on. But nonetheless, so how long has that Baker contract been in place?
It's a week yesterday.
So it's a week yesterday. Okay. Mm-hmm. So, and what were the parameters of that contract?
It outlines the circle of concerns between staff and Cindy and staff and her boyfriend, and then it also added Cindy's concerns. So, keeping the door locked at night because she wants to leave it unlocked so her boyfriend can come and go with no diseases. That she would participate in her online therapy, that she would participate in groups, that she would not be aggressive towards staff. She added that she would be calm and that she would be a queen. And so that was that she would abstain from aggression and walk away if she's upset. But she does very well. She'll walk away. It's just kind of supporting the circle to understand that that's her communication tool to say, I can't right now, I'm taking a break. So we added that she needs staff to role play with her to construct what happened when she is upset. And so that she needs staff to approach her and ask her if she's ready to role play.
Okay, so she'll do that. Mm-hmm. She'll work with you on role playing something that has happened and trying to work it out or problem solve with it.
She loves role playing. If you try to lecture her about it, she'll shut down. But she loves the role play. She loves being herself in the situation and then switching roles and trying to have a different sort of point of view from a staff member. And so she loves it.
Can you give an example of that? That's really interesting to me, because a lot of people they have a hard time doing role play stuff, but this is interesting because she sounds responsive to it.
She's very responsive to it. She asks for it a lot. I think, so like for example, her perception sometimes may be different than a staff member's perception. Something that can trigger her often is how her belongings are treated. She very much likes to have a clean, quiet home. And if staff members slam doors, that's a trigger for her. They might not have helped if the door was slammed, but she did. And so it will often trigger verbal aggression, which can quickly escalate to physical. And so if there's conflict there, they can prompt her, Cindy, why don't you go to your room? Or why don't I step outside on the patio and kind of take a break from each other? And usually it comes profanity from Cindy's part on how and why they should be respectful to her things. But when she's calm and they approach her, she needs at least probably half an hour. When she's calm and they say, hey Cindy, I would really like to role play with you what just happened. Are you open to that? She'll be like, yes. And then they kind of just rehash what happened when she's calm.
Yeah.
It can be hard for staff, I think, because the emotions can escalate in that kind of process of verbal and physical aggression. And so that's something that I talked to Cindy about. Staff members might need more than, 20 or 30 minutes to initiate role play, especially if you tried to bat them or if you threw a lamp at them. That's to help her understand that everybody has to be calm, but staff have to initiate the prompt to Cindy when they're ready for role play.
Yeah. Michelle, I'm echoing for some reason. Would you have any idea why? Maybe it's over now. Or am I on? Can you hear me?
Yeah, we can hear you.
Okay.
I think it's just yeah, with 3 presenters being unmuted at the same time, sometimes their speakers can be picked up occasionally.
Yeah, this is a curious thing. I was thinking back, to the training that Julie Brown did, because this was interesting how you brought up this role playing with her, though, because Julie Brown taught several different skills, but some of them were known as calm only skills, and problem solving was one of those. Now, role playing is a little bit different from problem solving, but there's a problem solving component to it, and it is usually I've found if you try to do problem solving in the midst of the problem, it's not going to work very well. If you try to do role playing, so if you start saying, let's play roles right now while somebody is really angry, they're not likely to respond well to that. So yeah, I got a role for you to play. You play the one getting hit right now. So it doesn't work that well, but when you recognize that this is something you can work on when you're calm, and it does, you are shaping the way people think about things, though, going forward, and maybe preventing future episodes when you practice that way, practice those behavioral skills that you need to get through those situations. So I think that's really good stuff that you're working with. I was wondering, because I don't want to belabor the question of conservatorship too long. I just want to explore it a little bit, though, because this is such a dilemma. I will tell you, I've agonized over this a little bit over the months that we've been dealing with this situation, because there is this idea of whether or not she needs a conservator. And I think part of that was that at one point we thought she was potentially going to be admitted to the Harold Jordan Center, and that she would not consent to having that done. And so part of the consideration there was, well, she had a conservator, she could be admitted to the Harold Jordan Center. The conservator could voluntarily have her admitted there. But that's usually not the reason that we, just to get a particular treatment or just do something in particular that we want to do that, but we want to say, we really have to talk about the person's capacity to consent, right? Okay, so capacity is composed of what's called rationality, basically the ability to reason, the ability to think about the situation that you're having to make a decision on and be able to weigh the pros and cons of that before you go into it, that you have enough information, so it's a reasoning ability, information. So if you don't have enough information to make a decision, it's not a valid decision. And if you're not willing to kind of seek and get yourself educated on something enough to be able to make a decision, it's not a good decision. And then thirdly, that you're not being coerced in any way. So if you're being coerced, it's not a valid decision. Those are things, if they're not there, any of those things, that's going to invalidate a decision a person will make. That's why if you do a car deal with somebody, but you don't reveal all of the elements of, that you're required to reveal in advance, the contract's not valid. And the same thing would hold true of people making basically everyday decisions in their life, is that if they're not informed about it, if they don't have the reasoning ability to weigh the pros and cons, then that's not a valid decision. And so, a couple of things that I think about is, like, for her, if she had a conservator, what would change if she had a conservator? And so from your perspective, how would it change? Just wondering from what you think.
I think I mean, she might be able to get into a place like Carol Jordan Center with a conservator, like you said. A conservator might say, yes, she needs VA services. Currently, she refuses VA services. Conservator might be able to, put their foot down and say, like, no, boyfriend can't come over. But still, it comes to the point where those things have to be implemented. So a conservator can say yes or no, but when it comes down to like implementing those things, she's got to be a partner in that too. So I'm torn too. I see benefits to a conservatorship. I think it could open the door to services that she doesn't have right now. I do think that there would be some risks, though. I think that it would be a very invalidating experience for her, and she's not one that trusts people easily, so I think that would make it even harder for her to form relationships with staff and these other providers that she might, be able to get with a conservator. I think that would be difficult. It would be difficult to get her buy-in if she was forced to have a conservator, I think. Do you have anything else, Erin, to add?
Well, I think so as well. I was thinking about Cindy this morning and how she's very young, and so just coming like out of the system and into the IDB, she's kind of only been able to make her own choices for like 4 years. Since she's no longer 18, she's 22, and I think her whole life she's been in the system since she was 2 years old. I think she always has somebody telling her what to do, whether it is or is not in her best interest. And just having her say what she has told me about her background, I think she's had more being told to do things that are not in her physical or mental best interest. And so I think it could potentially trigger some underlying trauma for her.
Yeah, basically it would start to maybe, I could see that. Now I thought about this. This is a terrible way to, it almost sounds like a backhanded way of saying this is not a good thing to do. But thinking about the concept of Stockholm Syndrome, are you familiar with it? This is where somebody gets kidnapped, that ultimately sometimes we start becoming sympathetic to their kidnapper. And I'm not exactly saying that could happen with conservatorship, but I will say that there is the possibility that if somebody is forced into a situation that maybe they don't like at the time, but it gets them into a better situation ultimately, that they do adapt to that over the course of time. Sometimes you can set a limit for somebody and just say, hey, this is not happening anymore. And while at first it's, terrible, then, eventually there's the person resigns himself to that and it ends up being a better thing. It's hard for me to think about it that way because it is, like you said, it's invalidating to do that. But, the question is that what's going to happen? Or is the outcome of it going to be basically we just get resistance and it becomes a battle royal? And that's why I said I let you preview these questions. I said it's not a rhetorical question to ask whether trust is going to be broken with this. I mean, the other side of it is, the other thing to think about is whether or not, over the long term, that it actually increases trust to do that, to kind of take over the situation. I really only mention that to kind of present the other side of it, to say, well, that can happen.
Well, that's what I was telling her with her boyfriend, is that, going back to what you said about setting boundaries and limits, that's how you have a healthy relationship. You set boundaries and you set limits and you believe that one another are going to abide by those boundaries. and that teaches others how you want to be treated, and it's how you build a healthy relationship. And so that, you know, I think it would be very rough in the beginning, but over time it could be supportive of her because her capacity changes. You know, if she's taking her meds and she's participating in therapy and she is physiologically stable, she is, I mean, she's delightful anyway, but she's just very remarkably astute. When she's not taking her medication and she's not engaging in therapy and she's been with her boyfriend for days and days upon end until he decides to cavort around and leave her for however long, it's very hard on her.
Yeah, one of the things about it is there's no question it seems like this is an unhealthy relationship. I mean, there's no part of me really that thinks this is a healthy idea for her to be involved in this relationship. The other side of it is, of course, people participate in unhealthy relationships, you know, in varying degrees all the time. And, you know, we were talking about the police response to the situation being so much different than ours, as far as the IDD system, because they see relationships like this a lot, I assume. And so they become a little bit desensitized to it, and they're not as likely to be as responsive to the situation as we are. The question, I guess, and you mentioned a few things there that are really like things we'd like to get her doing, because you were talking about if she's taking her medication, then she's more lucid. You know, she's more talking about the rationality part of being able to make decisions. She's more rational under those circumstances. She's able to take in information and understand information and make better decisions. And so and I was thinking about this also with regard to the limit setting for the boyfriend, because that seems to be a habit that she has a hard time with, is saying to him no, or saying to him, this is, you know, I'm not going to give you all my money, or whatever. And so if you were able to establish those as behaviors that you wanted to see increase, then having everybody kind of working at reinforcing those things when they are seen to occur would be good, or reinforcing her when she takes her medication or goes for her Invega shot.
Yeah, I just wanted to add, I think we're definitely on the right track with the contract component. I think one thing that Erin seems to be doing a good job of is being an ally to her, as opposed to another person coming in just expressing concerns with everything that's wrong about the decision she's been making or the choices she's been making. I think being alongside her and just playing that supported decision-making role of here are the risks and benefits of some of the things you're doing, or even training her to start doing that for herself. You know, if you do this, what could happen that's good and what could happen that's bad? And just having that role with her, especially when she's rational and on her meds, and I think building in the piece in the contract about being more involved in her healthcare is great. But I definitely think that moves more in a direction that addresses some of those concerns about her past trauma and her past always being in that being told what to do position, as opposed to bringing a conservator in and going the more restrictive route of, you know, giving another person an authority over her. I really just want to applaud you for what you're doing with the contract and just being that neutral ally.
Thank you.
This is John Johnson. Could I ask a question?
Yes, sir.
A party that has not been mentioned is the provider, or at least I haven't heard the provider mentioned in three. Given that there's an inverse relationship between the level of protection provided to a person and their room for growth, what role does the provider play in terms of responsibility for the health, safety, and welfare of this young lady?
So, Rachel or Aaron, the way I think to answer this question would be like, what is the provider doing for her at this point? Are they helping her in any way?
And what is their responsibility?
What should they be doing to help her at this time, given the plan that we currently have?
I think they're doing their best to support her without infringing on her human rights. They call quite a bit about what to do when, and so we've given them guidance on like emergency route restrictions, advise them very often to call mobile crisis or to call 911 to get Cindy and themselves out of the situation if they're ever fearful. I believe that's what the provider is doing now. There may be additional components that they're implementing, I would imagine so, but they tend to just call the VA unit or let me know about any kind of human rights.
At some level, it seems like it's just a base level, really, though, of protection from harm. I mean, so it would be only protection against the most egregious risk or concern. Otherwise, it's sort of like kind of monitoring a kettle that's about to boil over almost. So I don't know if that's a good way of saying it, but you know what I mean. It's very tenuous type of protection.
Let me give a specific responsibility for our times, the COVID threat. Here we got this boyfriend coming in anytime he wants. We don't know where he's been. He's refusing to wear a mask, so he's not only exposing her, possibly exposing her, but he's exposing possibly the staff of the house. I think the provider agency has some rights to say, no, you were coming in here. We don't have any obligation to you. You're posing a threat to not only us, but to her also, and you're not coming in.
Valid point. John, if I could push you just one step further on that. So what do you do if you can't make it happen? How do you make that happen?
Well, he's trespassing, is he not?
Well, that's questionable. If her name's on the lease, she's inviting him in.
Yeah, it's her name and the agency's name on the lease.
So the agency's name's on the lease also.
Yes, sir.
So they have some authority here because their name's on the lease.
Okay. Well, there's a thought. I certainly see your point there about protection from harm, especially with COVID-19. That is an increased concern, and it is. I do think that the agency finds themselves in this very awkward position with respect to it.
Expand that a little more. Every supported living house that I'm associated with, the people that live there, names are on the lease. But that does not excuse or does not exempt the provider agency from their responsibility for that person's health, safety, and welfare.
All right. I'm going to accept that without any further discussion on it, except to say that I think the difficulty with this is when you remove that relationship or when you remove the ability for this person to engage in that relationship, there are a host of problems that come as a result of that. And as I said a moment ago now, maybe the idea is, and of course, one of the ways that limit could be set, this actually adds to the list of things that could be done if a conservator were in place, is that if restriction of association were placed as part of the conservatorship order, that the conservator would be able to do that. John, and I just kind of harken back to your experience with that, because I know there have been times where you've been conservator and you've been frustrated because it really, that you didn't necessarily make the shift over to be able to really control as many things as people originally thought that you would be able to do. And I just, in that light, wonder how you would look at this situation.
Well, I'm looking at it from the provider responsibility, whether there's a conservator involved or not. As conservator, and I think any parent who has placed a person with a dead operating facility expects that provider agency to provide some level of protection from harm. And that's what I'm asking about. What is the role and the responsibility of protection from harm?
I'm interested in other people's opinions about that. If anybody else wants to come on and discuss it, I do think it is a question you have to ask yourself for every person. What is the level of your responsibility? I do think that varies by the person that you're dealing with, because if I just take the simple example of or contrast of a person in the profound range of intellectual disability versus a person in the mild range of intellectual disability, my responsibilities are going to be much greater in caring for a person who has a profound intellectual disability than a mild intellectual disability. And even within each of those levels of disability, there are differences that people have that would affect how much responsibility I take for the situation. I get your point there about the agency having some responsibility themselves, if nobody else, about protecting themselves from COVID-19. One of the expectations our department has with respect to this is that agencies are going to respect decisions that people make and respect relationships that they choose to engage in. And so this is where I think it becomes a little bit of a dilemma for the agency versus something that seems, too black and white as to how you should respond to it.
I think it just goes back to that balance between safety and rights that is always the dilemma, from the circle standpoint or the provider standpoint. It's just finding that balance, because if you think about it from the perspective of, okay, well, let's remove this relationship altogether, which we know she's not in agreement with, is that just going to push her more in the direction of seeking out that relationship? So is that going to increase her elopement to get to him? And is that a greater risk than being able to monitor their relationship in an environment where you are able to call the police and see what's happening and things like that? So I think it's really just looking at the risks and benefits of both options, as well as trying to figure out how to balance the safety and rights there. Because I think it could lead to potentially riskier situations if you push him out and, in a sense, end up pushing her out towards him.
I'm interested to see if anybody else out there has any commentary on this or thoughts. Everybody's staying kind of hush-hush. John, did you want to make any further comment?
No, I'm trying to get myself muted. Have I succeeded yet?
Well, not at this moment, but
I'm working on it.
I can help you with that if you need to.
Hey, let me tell you something, though. I really appreciate you coming on, and I wanted everybody to know I always invite counterpoint on this, because these are difficult situations. They're not like it's not easy to resolve what we're trying to deal with here, and it's not. I don't know that any particular solution to it is all inclusive and addresses everything that is of concern here. So I do want to invite anybody else who might have any thoughts here to join in at any point that you think you might like to. Let's see here.
Contributing to what Michelle mentioned about her following him, after he was arrested, she moved apartments. And as soon as the boyfriend called her from prison, she immediately gave him a new address. And she immediately was telling him he's welcome anytime. And she was very apologetic for him being sent to jail, because she's the one that called the police. And so she thought her experience with the police has been a very a de-escalation kind of conversational. And so I think she thought that was going to happen to her boyfriend. They were going to come and talk him down. They would tell him to be good, but he was arrested. And so she felt a lot of remorse. She told me several times, I just wanted to teach him a lesson. I didn't want him to get arrested. And so I think Michelle's right that she would seek him no matter where he is. Because they have a history. They were high school sweethearts, and then they disconnected, and they recently reconnected. So he's kind of a stable, you know.
It's as unhealthy as it seems, it's something that for her offers some level of stability.
It's the only person in her past that's still around. You know what I mean?
Yeah.
She has no family. It's the only relationship in the past that she has now, and I wonder if that has something to do with it.
I'm quite sure that you're probably right, because somebody like her, particularly people who've had extreme trauma, are looking for anchors of any kind. This other person that we've talked about on here before, and that we have, she has borderline personality disorder, has a similar relationship to her mother, and it's been a very volatile relationship with her mother. But that's the one kind of unstable influence she's had in her life. And there were many times I thought I was trying to get her to give her mother up. You know, this was such an unhealthy relationship that I just wish you'd quit trying to find your mother, quit trying to talk to her, quit trying to get in touch with her, because every time you do, it ends up being a problem. And then there were times where she had committed to that. And then there was immediate, you ever heard of buyer's remorse? It's like buyer's remorse within almost instantaneously after crossing the bridge and saying, I am giving up on my mother. And so once she gave up on her mother, it was like, oh, I can't believe I just did that. It was so disconcerting to her that it would result in another kind of problem behavior episode. And it seems like she's got a similar relationship in some ways to her boyfriend. And I did want to ask this question about the boyfriend in particular. So I know everybody's concerned that he may be exploiting her in some manner, especially with money and so forth. Since he's re-entered, you said something earlier that made me think maybe there has been another physical altercation with them, but I did want to clarify. Has there been any kind of physical harm to self or others since the boyfriend re-entered the picture recently?
She attacked a staff member and bit her very severely and scratched her face. And then the boyfriend and Cindy have been physical with one another as well. I think he pulled her hair. They were arguing and he pulled her hair, and so they engaged verbally back and forth, and then her and the staff members ended up going for a walk and then sitting in the staff member's car to just kind of calm down so long.
And so whoa. I'm echoing. Did she was she counseled to contact the police under that circumstance, or was it how was that?
I would advise them to, if they are ever in fear for themselves or Cindy, call the police. Call the police. Call over and over and over again if you have to. And they're very hesitant to, so I was asking the couple where that hesitation comes from, and they were saying that they're afraid that Cindy will then attack them. Because they said, well, Cindy won't let us. She won't let us call the police. And I said, you don't have to ask for permission. You need to call the police and keep them safe and keep you safe. But then I think their fear is when they call the police, she then attacks them.
Yeah. And so this is not, the police even deal with this on a frequent basis, that somebody will call the police, but then when they come in there to take action, that the wife or girlfriend or whoever is being abused will then kind of turn on the police and say, hey, I don't want you here. I don't want you to don't do anything that they want out of it. And that is a symptom of being a battered wife or battered husband. The police find themselves in a very a bad dilemma. The police have the ability to press charges in those circumstances, but it's an uphill climb if the person is not willing to do that themselves. And it seems that at some level she needs to be strengthened to do that. And to go back to John's point, there is still the concern that maybe we need to protect her from herself under the circumstance. And I think that continues to be what everybody's trying to work out is where is that line here that we need to do that.
Question in the chat box, wondering if APS has ever been contacted. I'm assuming somewhere in those incidents that was part of their reporting.
I can ask the ISP if so. I feel as though it's yes would be my answer.
There was another question is asking if the provider's requiring staff to wear a mask in Cindy's home.
I'm not 100% sure that when I talk to staff, everybody's in a different location, so they don't have any masks on. They may be though. I would imagine so, but I can follow up with the agency and ask them.
We have recommended that people wear a cloth mask while they're at work within 6 feet of any other person. That is a recommendation to agencies, not a requirement. I do want to point out one thing about mask wearing, especially when it's a cloth mask, that the protection is more for others than it is for the person wearing the mask. They're not very protective as it relates to preventing COVID-19. In fact, even the N95 mask is only somewhat protective. I think I heard that the coronavirus is 1 micron in diameter, whereas the N95 mask has gaps that are 3 microns. So there's, even with an N95, there's still, which is the sort of the gold standard, there's still the potential of something getting through. And when it comes to a cloth mask, it's like wide gaping holes. Even though it doesn't seem that way, it's wide gaping holes there. If you're in a situation where there is mist in the air, like someone sneezes and there's mist in the air, it's going to go through a cloth mask very easily. But if you have a cloth mask on, it's going to prevent that from being sprayed as far. And so it's going to protect others more than self. I think that's one of the big myths about masks in general, particularly cloth masks.
Hey, Erin, has anybody ever sat down with Cindy and kind of talked to her? I know everybody's probably talked to her about the boyfriend, but has anybody ever asked her what she gets from the relationship? Like what it is about him that's special, if it's just because he's been there for so long, or if it's because he makes her feel important, or if there's kind of like the function of what that relationship means to her, and is it possible that she's not getting that same interaction from others? I mean, I don't know if they have a physical relationship, but I just mean in terms of the social interaction. If she doesn't feel that same, with anyone else, then that could be some component of that as well.
Yeah, that's an excellent, that's actually something we haven't tried that. I haven't point blank asked her, how is this fulfilling you? If you ask her about him, she'll say, I love him, or he's so cute, or She enjoys taking care of her man, but it's all, she hasn't ever said, like, she makes me feel like, so that would be very interesting to ask her.
But I wonder that, he makes her feel needed. She feels helpful to him when she's, giving him money or doing things for him. Or, I just wonder, like, what, if she's able to verbalize any of that. I know it's very not behavior analytic of me, but just to kind of determine, like, the function of that relationship for her. And, is she getting that from anywhere else?
I think that's an excellent question because she is very, very, very given. She actually had a problem at one point last year as she was giving all of her food to people that were homeless in her area. And then she would go hungry. And so I'm sure she does associate that giving him shelter, giving him money with affection. I don't know, that's a good question. I'm going to have to answer that.
I think it's a real good question from a couple different perspectives, Michelle, because, and I do think it fits within a behavior analytic paradigm, actually, because, first of all, the personal, I asked the question, is she making decisions based on a personal value system or is she being coerced? And, those are two different functions of the behavior. If I'm being coerced, that means that she's afraid of, I'm saying, is she afraid of the boyfriend? And is that the reason that she's doing all this? Or is she just such a giving person, that this is the type of relationship that she personally wants? And that makes her feel, as you were saying, that Michelle provides positive reinforcement for her, essentially.
I would just think, unless it's the coercion piece, that there's something about that relationship that's validating her feelings and her social interactions with him and trying to figure out exactly what that is and understand it, I think would help to guide, how to approach her about it regarding the supported decision making.
Yeah, and I think it would also help us determine appropriate replacement behaviors for that. Obviously there's parts of a relationship we can't find a replacement behavior for everything, but I think if she is getting some sort of, she's being helpful and she's getting those feelings from, helping her boyfriend, then maybe we could look into other ways she could be helpful, volunteering opportunities. I did have a suggestion last time about, maybe a pet, somebody, a dog or a cat or a hamster or something that she could take care of and fulfill that need too, if that is one of the reasons that she is staying with him. So I think it would be worthwhile to find out, her reasons, what she's getting out of the relationship. So maybe we could find out how to help her get that somewhere else so that she's less needy for that attention from him.
Yeah, how to get it healthier life.
I think part of it too is that she desperately wants to have a baby. She desperately wants to have a family, and when you ask her about why she wants to have a baby, she wants that baby to feel loved like she wasn't loved. She's never going to put her baby in the system. She's never going to give up her baby. And I think her opportunity to kind of, I told her she likes to list her goals, and that's on her goals, is to have a bank account of her own, to keep a job, to have a baby.
Yeah, I wonder if you could work on stepping her up to caring for something in addition to caring for herself. But, this is a horrible example, but with AA, they do the thing where you have to take care of the house plant and keep it alive, and then, maybe a fish, and then a cat or a dog, or, and just kind of work up to show us that you can be responsible and care for something and take care of yourself, because those two are important things that you have to be able to do as a mother.
Mm-hmm.
Yeah, I think that, okay, I'm going to go ahead and just own my judgment here. Okay. I don't think it's a good idea for her to do this. Now, I'm speaking for myself. I can't speak for her in this because she doesn't have a conservator. She doesn't have somebody making the decisions for her. And even if she did, this is a dicey issue. Forced birth control. And the reason that it's so dicey is because, this was a major issue back in the 1930s, 1920s, 1930s, earlier in our country's history, when people with disabilities were sterilized, and the Supreme Court has basically said you can't do that. And even though it puts us in a real awkward position where we look at a situation like this and we say, oh gosh, that would not probably be what most of us would think would be a good idea.
Sure, and I'm not necessarily promoting or saying yay or nay in that regard. I was just trying to think of how can we use this to motivate her to meet those needs for herself and take care of herself better and kind of work towards her goals.
No, I agree. I'm not, and I wasn't actually responding to anything you said, Michelle. I agree with you entirely on that. I think that's a great idea. I just was trying to think about this situation about even if it's one of those other really thorny dilemmas that we're in this situation, especially because of this historical context that we have for sterilization and people with disabilities. So that wasn't a reaction to anything you said. I think those were great suggestions as to how to proceed with her potentially. Okay, I'm going to open it up to people in the audience one more time, see if anybody else has any kind of other points that you want to make or thoughts about this situation.
Don't forget to unmute yourself if you have a question or comment. You can also put it in the chat box.
Yeah, one of the things I said in that email that I sent you earlier today, Aaron and Rachel, was that I hope to evoke some counterpoint views from the audience on how to approach her. So I really want to appreciate Dr. John Johnson for coming on and giving some alternative views on these things. I don't want to say alternatives. I actually, there are elements of this, I think, where that weaves into it, that there's perhaps are some limits that the agency needs to consider about the situation, and maybe some of those surrounding protection from COVID-19 would be part of that. Protection from other aspects of this would be part of it. And it sounds like you built some of those things into the contract, Aaron. So I think that's a good thing, as long as the contract's being carried out and pursued, that's being addressed, but, might need to consider whether there are other elements, other things that need to be included in that contract. And then what happens if the contract's not fulfilled? Is there any contingency with the contract that you have with her, Aaron, or is it more or less just kind of an agreement in principle between the two parties?
Really it's agreement. I wanted her to understand that she has to help staff safely support her. And so she needs to participate in her care.
Right. So more or less reinforcement of her carrying out the contract, or if not, at least a verbal validation that people would have of her carrying out and doing what she's agreed to do in that contract. Yeah, well, this has been a fascinating discussion. I wondered if we'd have enough to just talk about for a year, for a whole hour. I said a year, but I meant a whole hour. I did want to ask, I did have one other question and I won't ask you to answer this. I will let this just be kind of a rhetorical question. And this is one to continue asking throughout working with her and trying to make the best decision about how we proceed. But one of the questions I have is, are you in the midst of a very, very long shaping process? Because I think you have hit on what some of the skills are that you need to build for her and what you need to try to promote for her. It's just that it's going to take you a while to be able to get her moving in that direction. And I don't know how far you can go with it. And how far you can go with it is a real serious question, because that may define at what point you need to take control versus allowing her to continue to have control. You see where I'm coming from? And so I think that's an ongoing decision that has to be made. I do want to underscore that I have seen people come to a point that they get better. I mean, I'm not, that person we were talking about at the beginning who we were really worried about, and the same question had come up for her. I'm not saying in any manner of speaking that she's doing perfectly well and living a wonderful life now, but she has made quite a bit of improvement in that, and has had far fewer circumstances where she's lost her rationality and basically, had difficulties. And in those circumstances, we do have a system that addresses that. There's the mental health system that addresses that. So I just want to congratulate you guys on working with a very, very difficult situation, and congratulate the Circle of Support as well for hanging in there. I know it's not been an easy process with this and figuring out all of these little pieces that need to be done for this person, and where to set limits, where to allow personal decision making. And so I just want to thank everybody for being involved with this. Thank you particularly Aaron and Rachel for being with us today on a CCM. We do this every Tuesday at 12:30. Sometimes we do it on a Friday at 12:30. So I hope you'll continue to join us on the Clinical Consultation Network. Thank you for being here, everybody.